Good day, learners. I'm Ray Gapuz. I'm a test preparations coach for the last 25 years, and I've been doing coaching classes for NCLEX RN, both here in the Philippines and internationally. I'm also an author of two test preparations guidebooks for the NCLEX RN, which are internationally published. My Western and my Eastern education has enabled me to come up with guidelines, which I call functional concepts. And these concepts are the ones that are helping nurses to deconstruct questions on the NCLEX RN. So I'd like to share with you some of these functional concepts as we engage in our learning sessions today. Today's lesson, we'll talk about bipolar 1 disorder and lithium carbonate.
I've gotta do, so I'm not crying.
So just a brief overview, when we say bipolar disorder, it's actually a lifelong mental health condition that's characterized by extreme mood swings. And we have two major types. We have bipolar 1 and bipolar 2 disorder. Now, what's the similarity in these two subcategories? The similarity would be in both conditions, the patient would usually have at least one major depressive episode. But in bipolar 1 disorder, in addition to the major depressive episode, there's also at least one manic episode that is preceded or followed by a hypomanic episode or the major depressive episode. Now, if we're going to compare that to bipolar 2 disorders, in bipolar 2 disorder, there's actually at least one major depressive episode and one hypomanic episode. Okay? Lithium carbonate is a drug that's used for the treatment of bipolar disorders. So let's proceed. So let's have a sample question for this concept. The nurse is evaluating the effectiveness of the treatment regimen for a client with bipolar disorder who is experiencing a manic episode. Which of the following statements by the client would indicate that the client's treatment plan has been effective? Now we have to consider two things here. If we're reading the question, you will notice that you will have to pay particular attention to the main diagnosis of the patient, and that's bipolar 1 disorder. And the phrase on the question that says, which would indicate that the client's treatment plan has been effective. So when we talk about treatment, what do you need to recall? Think about lithium carbonate. So for you to be able to answer this question, we need to have some guide. And actually, these guides are what I call functional concepts. A functional concept could either be a word, a phrase, a sentence that serves as a guide to help you deconstruct questions on the NCLEX. So here's an example. A bipolar disorder is characterized by, now here's the mnemonic bipolar. Behavioral extremes. Now you would notice that patients with bipolar disorders would usually have either a high energy state characterized by agitation or anxiety with restlessness that's actually alternating with depressive episodes characterized by loss of interest in pleasurable things or activities. Then you have either insomnia or hypersomnia. So a depressed patient or a manic patient could either have difficulty sleeping, or a depressed patient may have excessive sleep or excessive amounts of sleeping hours. Next, for decision making, a bipolar client would usually tend to be very impulsive with their decision. They want to do a lot of things at the same time. So usually that leads to failure to achieving a specific goal because of impulsivity. Overspending, they love to go shopping, they engage in spending sprees, and sometimes without due consideration if they still have money that is left for them, okay? And then labile affect, so there's going to be rapid swings in terms of mood. Sometimes they get hyperactive, other times they get too depressed. And then alternating mania and depression, and finally racing thoughts, specifically for manic patients. Usually they have a lot of ideas coming in all together, and sometimes those ideas doesn't make sense anymore, especially when the patient goes into psychosis. Treatment of bipolar 1 disorder involves the administration of lithium carbonate. Okay, if we talk about lithium carbonate, it's very important that we know the therapeutic level of the drug. And the therapeutic level of the drug actually depends on the age of the patient as well as the phase of treatment. So we have to remember that the serum lithium level depends on the age of the patient and the phase of treatment. So for those who are below 65 years old, the acute dose would be 0.5 to 1.5 milliequivalent per liter, and the maintenance dose would be 0.5 to 1.2 milliequivalent per liter. For those who are 65 years old and above, the acute dose is 0.6 to 1.0 milliequivalent per liter, and the maintenance dose is 0.4 to 0.8 milliequivalent per liter. Now, take note that if the patient is taking the drug during the acute phase of the treatment, the lithium level that is required is higher because this is needed for the drug to stabilize, for the amount of the drug to stabilize in the body of the patient. And then for the maintenance phase, usually the dose is lower. This is important because too much lithium could actually lead to renal failure. So you would notice also that when the levels of lithium reaches 2.0 to 2.9, then we have what we call toxic levels. And when it reaches 3.0 and above, there could be a fatal complication. So it's very important that emergency intervention should be implemented when the lithium level has already reached 3.0 milliequivalent per liter. Now, treatment with lithium carbonate requires definitely the gathering of blood sample, and usually if the sample is gathered, it's best done 12 hours after the patient's last dose, usually before breakfast the next day. Now, for the first 2 weeks, the monitoring is done weekly, and after the first 2 weeks, monitoring is done at 1 or 2 months interval for 6 months. Once it's stable, the lithium level should be monitored every 3 months thereafter. Now, after the first year, plasma lithium levels are measured every 6 months. Next functional concept. After the first year of lithium treatment, serum level monitoring is done every 3 months for the following. The older people, it should be done every 3 months. Patients who are taking drugs that interact with lithium, like those who have diuretics. Patients who are at risk for impaired kidney function, because lithium is primarily and exclusively excreted by the kidney. So it's very important that the kidneys are working if the patient is taking lithium. Patients who are at risk for impaired thyroid function, once again, the thyroid glands are affected, and patients with elevated calcium levels, patients with uncontrolled symptoms and poor compliance, and patients with lithium plasma level of 0.8 millimoles per liter or 0.8 milliequivalent per liter or higher. So a safe blood level of lithium is 0.6 and 1.2 milliequivalent per liter. Next functional concept, let's remember that lithium toxicity can happen at level 1.5 milliequivalent per liter. So if you would notice that 1.5 is still classified as a therapeutic level, specifically in the acute phase of therapy for patients who are below 65 years old. But note that even if the level is at 1.5 milliequivalent per liter, if the patient begins to exhibit symptoms of lithium toxicity, then we can therefore say that the patient is indeed having a toxic reaction related to the drug. Severe lithium toxicity happens at level 2.0 milliequivalent per liter, and lithium level at 3.0 milliequivalent per liter and higher are considered a medical emergency. So let's go back to the question. The nurse is evaluating the effectiveness of the treatment regimen for a client with bipolar 1 disorder who is experiencing a manic episode. Which of the following statements by the client would indicate that the client's treatment plan has been effective? Now that we have an overview of bipolar 1 disorder as well as the primary treatment, it's very important that we go through each of the options. 1, I have my blood levels obtained regularly to monitor medication levels. 2, I enjoy going on shopping sprees for clothing and jewelry with friends. 3, I avoid eating foods that contain tyramine. And 4, I'm too busy to sit down and eat a meal. Notice that your options 2 and 4 indicates manifestations of mania, which is typical in patients with bipolar disorders like spending sprees or shopping sprees and inability to sit down and eat a meal. Okay, that's the reason why manic patients are usually given foods that can be eaten on the run. Now, option 3, I avoid eating foods that contain tyramine. This is actually for patients who are taking monoamine oxidase inhibitors, because tyramine, when it combines with your MAO inhibitors, leads to hypertensive crisis. Therefore, the best answer is option 1. I have my blood levels obtained regularly to monitor medication levels. Why? Because the therapeutic levels of lithium is very near the toxic levels. So the answer is 1. Now, what are the things that I'd like you to remember about lithium carbonate? Let's focus on some functional concepts. Mild to moderate lithium toxicity is manifested by diarrhea, vomiting, tremors, muscle weakness, and drowsiness. Note that the tremors I'm referring to here begins with fine hand tremors that eventually progress to coarse tremors. Sometimes the fine hand tremors could be seen when the lithium level is at 1.5 milliequivalent per liter. Now, mild lithium toxicity usually goes away on its own when you stop taking lithium and you increase the fluid intake. That's because lithium is primarily and exclusively excreted by the kidneys. So once the kidney excretes the lithium, then the mild toxicity goes away. Moderate lithium toxicity is actually treated with stomach pumping, bowel irrigation, administration of intravenous fluids, hemodialysis, and vital signs monitoring. And when severe lithium toxicity occurs, it's usually manifested by hyperthermia, seizures, slurred speech, rapid heartbeat, and the low blood pressure. So in this case, there could be signs and symptoms of neurotoxicity, and the patient may even manifest symptoms of dementia as well as dysarthria. Now, let's remember that some food and drinks may affect lithium levels in the body. Example, salt, caffeine, and alcohol. An adequate amount of salt is necessary when a patient is taking lithium. Why? Because lithium is a type of a salt, but it's a type of salt that needs to combine with sodium for it to be diluted and excreted by the kidneys. Therefore, a normal to high sodium level is necessary. So when we say normal to high sodium levels, it could actually range from 3 to 10 grams of sodium for patients who are taking lithium carbonate as treatment. And high fluids would mean the patient should be having 2 to 3 liters of fluids per day to promote excretion of the lithium from the body. So sodium depletion is the most common cause of lithium accumulation because, as I've said, lithium needs to combine with sodium for it to be diluted and excreted by the kidneys. Next, if your patient's having lithium toxicity, activated charcoal can do anything. So activated charcoal doesn't bind to lithium. This is a functional concept. And finally, with lithium treatment, the following should be regularly checked every 6 months. Thyroid function, serum creatinine, serum calcium, the body mass index, and the estimated glomerular filtration rate. This is shout out time, so I'd like to congratulate a lady from Zamboanga del Sur, and that's in Mindanao area in the Philippines, Crystal Joy G. Pulido, who actually passed the NCLEX RN for the state of Illinois. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. Send in your request if you have any topics in mind that you want me to cover in my future videos. Email me, mentor.raygapuz@gmail.com. Disclaimer, this instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN.